Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I would like to share with you why it is so important, at least in my professional experience working with gender diverse people, what I have observed from psychological point of view, why it is so important to start voice therapy early on. Start voice therapy from the beginning of your transition. If transition is for you, if you are not happy with your voice, if you want to masculinize or feminize your voice, then I'd like to share with you, in my opinion, why it's so important to start from the very early stages. Now, I understand that voice masculinization and voice feminization is not for everyone. Some of you are very happy and very content with your voices, and if you are one of those people, that's great. The reality is that a lot of people who are transitioning are not really happy with their voices. A lot of people who are transitioning are also very concerned about passability. Now, again, passability is not for everyone, and if it's not something that's essential to you, that's great. For a lot of people, passability is still something that is very important to them. A lot of people do identify as trans-binary, and especially for those reasons, passability again becomes a goal. And if it's a goal, a lot of people become very concerned with their voices. Now, again, this is very subjective, and this is very personal. As we know, with testosterone, for a lot of people, voice will deepen naturally with just testosterone regimen. But for a lot of trans guys and for a lot of trans masculine individuals, testosterone sometimes doesn't really deepen voice, or it doesn't deepen voice as much as you would like it to be. So a lot of people do seek a voice masculinization just as much as trans women or trans feminine individuals would like to change their voice, would like to change the pitch, the sound, the resonant, and to modulate their voice to a sound, to achieve the sound effect that they really feel congruent with how they see themselves. So voice therapy becomes a very important part of transition, again, if this is something you're interested in. Now, in my experience, I've noticed that a lot of people tend to neglect voice therapy until later in their transition. And reason being is because there's a lot of misconceptions about voice therapy. One of the misconceptions is that once you start working on your voice, it doesn't really take long to change it. And while that may be the case for very few individuals, that is not the case for majority of people. Majority of people do need to spend more time working on their voice, more time training, more time on discipline and practicing their voice, modulating their voice on a daily basis. Another misconception people have is that they're going to go and they're going to be able to get voice feminization or voice masculinization surgery, and that's going to modify their voice. And reality is that insurances, in my experience, don't cover voice surgery. On top of that, all of the really good vocal surgeons are abroad, which requires traveling with additional expense. Not to mention that if you do get vocal surgery, there's no guarantee you're going to get the results you want, and there are still side effects, potential side effects of that surgery. So it's not really a bulletproof solution to modulate your voice. So a lot of people tend to wait until later in the transition. Part of people are waiting. Again, those are misconceptions that they have about voice training. Another part is that people think that the voice therapy is incredibly expensive, and I don't believe it has to be. There's a lot of voice therapists I work with who are able to meet with you either as frequently as once a week, and if that's not something up par on your budget, they are willing to give you lessons, to give you practices so you can practice and then check in once a month or once every 2 months for them to assess if you're doing everything right, because you really can damage your vocal cords if you're doing things incorrectly without any supervision. There's also a lot of gender centers now that offer voice therapy. Kaiser offers voice therapy. I know that UCLA Transgender Clinic here in Los Angeles offers it as well. So there's going to be a lot of clinic medicalized centers that are starting to offer it as part of their transitionary plan. So it is accessible. Not to mention there's a lot of vocal therapists on internet who are trained, who are licensed. It's important that the vocal therapist is trained and licensed, who are offering tricks and tips and different classes, how you can modulate and work on your voice. And yet for some reason people still do neglect it until later into their transition. And I think that's one of the biggest mistakes people tend to make. Now, I know that some people say, well, what is the big deal? Even if I neglect it, then I can pick it up and I can really dedicate time to it and I can change my voice, so there's really hasn't much damage done. And one of the things that I observed from my practice, which makes it so essential So essential to start voice training from the get-go. It's not necessarily that voice training is a discipline that takes time. It takes time to actually to achieve your voice, but it's actually something else. It is something else that is in sync with our mindset. It's in sync with our psyche. It's in sync with our thought process, if you will. And that is this: when you're starting to feminize or masculinize your voice in the beginning, what happens is you start working with a vocal therapist, right? And for a lot of you, what you're going to experience is that you're going to feel as if you're sounding phony, as if you're faking your voice. And then eventually you're going to get over that hump, right? Once you're going to get over that hump, a lot of you feel comfortable to now go ahead and speak in your more genuine voice now to people around you, whether it's going to be the loved ones, the coworkers, the friends, people on the phone. And that's going to be part of the practice. Part of the practice is going out there and being able to speak in your voice, being able to order food in your voice, being able to call somebody on the phone in your voice. And while that is something that a lot of you are able to achieve, one of the things that takes the longest time is to make an intellectual mental leap between constantly in your head thinking about modulating your voice. What that looks like is when you're out there and let's say you already achieved and your voice sounds amazing, and yet a lot of you, what you'll be doing is you will be in your head and you'll be almost like hyper vigilant about your voice. You'll be almost like hyper focused about modulating your voice, making sure you sound right. In other words, a lot of things are going to be happening here internally. So to make that leap, to make that crossover from actually speaking in your voice, but apart from that, also not thinking about modulating any longer, not being hyper focused about your voice at all, but doing it naturally. For those of you who are bilingual like myself or speak multiple languages, you know this. A lot of times, especially when we migrate to a different country, a lot of times our thought process is still in our native language until we become fluent in a second language, and then the leap happens and suddenly the thought process becomes in the second language that now we inhabit. It's the same thing I'm discussing here. It is making that leap between being hyper aware of what you're doing and being hyper focused on modulating your voice when you're out in public versus doing it naturally, versus not even thinking about it, versus just being so in touch with it that if somebody asks you, can you now revert back and can you now go back to the voice you had prior? Now that is something that's going to take you some thought process. That is something that now you're going to have to think and remember how to do. Do you see what I'm trying to say? So it's something that the leap happens, and when it happens, a thing becomes so natural and so innate. To make that leap takes time. This is why starting voice therapy training from the get-go is so important, because if you don't make that leap while you mid transition, what happens is that once you do transition and you're out there and you feel confident and you feel great about yourself, constantly being hyper focused now about your voice and modulating it can make you anxious, can induce anxiety, can make you insecure, can make you feel a little bit paranoid that, oh my God, what if I can't modulate it right now? Especially during certain situations. Let's say a sports game where people are screaming and shouting, or at a concert where a lot of times we're not even conscious, we're just doing automatically things. During intercourse, for example, when you're orgasming and you're making those noises, a lot of times people become very hyper vigilant during this process. As a result, their confidence in themselves can be affected. Because now you're thinking, oh my God, now that I feel fully completed transition, I'm still so much in my head thinking about modulating my voice. For this reason, you want to start voice training from the beginning, especially if you can. You absolutely should, especially if voice is something that matters to you, because it's going to help you a lot, and it's going to help you to make that leap quicker. The quicker you make that leap, the quicker you can integrate in your voice, and the quicker you can stop being so hyper focused about modulating it. So for that reason, I have observed a lot of people again tend to neglect it, and when I work with clients, the first thing I tell them is start voice training. Start focusing on voice training. If you can't afford voice training, at least see if you can afford maybe just a single session with a voice therapist, and ask them to give you some lessons, ask them to give you some tools, something that you can do on your own, and then check in with them, look up some resources, look at the clinic where you're going. Are they offering voice training? all of the things have become really important. It's really, really important to start from the beginning so you can achieve that. Again, that is something, if that is something that's really essential to you. Voice is not for everybody. Not everybody really concerned about the voice. And again, that's great. If you're not concerned about your voice, that's wonderful. A lot of people I have observed are concerned about the voice. Comment below, let me know if you have experienced this, where you finished your transition and you're still so hyper aware about your voice, and what did it do for you? What kind of effects it had on you? Did it affect you confidence level? Did it affect you anxiety? Comment below if you started voice therapy training early on. Did that help you to integrate? Did it help you to make that hump over, to kind of become more conscious about it, for it to be operating on autopilot? That's what we want. We want it to become an autopilot response, right? It's the same way that we do things, a lot of things in a house, in autopilot, where we don't even think about it. We just automatically engage in them. That's where you want to be with your voice. Your voice is essential to you because it's going to help you. And to get there, you need to start voice training early. So comment below, let me know. I'd love to hear your comments, and I'll see you guys all next time. Bye.